Mental Health Monday
on Radio City Talk
with Mick Coyle.
Tackling the stigma.
Radio City Talk.
And welcome to another edition of Mental Health Monday from Radio City Talk. My name is Mick Coyle. I do hope you're well. Thanks for joining us on the programme today. We talk about mental health on the radio here at Radio City Talk. It's something we're proud to do, something we continue to do as well, with some wonderful and fantastic guests. And another brilliant guest on the programme today. We welcome to the studio the Chief Exec of the Mersey Care NHS Trust, Joe Rafferty. Joe, great to see you. How are you, sir?
I'm very good, Mick. Thanks very much for having me.
I'm calling you sir. CBE. Joe Rafferty CBE.
Yeah, you're jumping the gun there. But.
Congratulations on the New Year's honour.
Thanks very much.
Before we get into the work that you do, just tell us, what's the process there? Is that a letter through the post?
It's a letter through the post, which in effect says, you know, we want to offer you this honour, and essentially it just says, then, do you want it or not? And you're then sworn to secrecy for a couple of months, and then the only formal notification after that then is the New Year's Honours list itself. So you've got to pretend to be very surprised, as if you didn't know about it.
So have you had your moment at the Palace?
No, I haven't. I'm due that on the 5th of March.
Excellent stuff. And does that come with a +1?
That comes with a +3.
+3. I can, That's not me looking for an invite, by the way.
So I've got 2 sons and a wife, and they'll be accompanying me on the day, which is just great. You know
when you sort of you get home from work and you see the post on the floor, and you can almost dismiss some of it because you think, oh, that just looks like a, you know, whatever it is, junk mail, spam, bill. When that letter arrives, is it like I don't know, is it like a better quality letter? Do you pick it up and go, hang on a minute, what's this?
It was really funny, but like a lot of people now, I do nearly everything online.
Right.
So when my post comes through the door, it's 95%, you know, pizza offers and things like that. So I have a habit, I pick it up and I set it on the table in the hallway. And I did exactly the same that day. And then the pilot got so embarrassingly high that I thought, well, I better, you know, do the recycling bit here. And then came across the letter, and it was face down, and thought no more, but turned it over. And of course it says something like, from the Cabinet Office, you know, private and confidential or something like that. So yeah, I did start to think at that point, this is not a usual sort of bill, you know, flyer or whatever. And yeah, it's a very nice letter on beautiful paper. And I think starts by saying, you know, the Queen has asked the Prime Minister to ... So yeah, it's a slightly strange experience. It's not an everyday thing.
No, not at all. A testament to the work that you've done. I like to talk about the fact that Merseyside, Liverpool is really at the forefront, the vanguard of the sort of the mental health revolution, which is ongoing at the moment. And actually, when you look into it, the work that you've done and the work that you've inspired, the work that you're commissioning, is very much at the forefront of some of that incredible work. We focused, you know, the Zero Suicide Alliance on the programme before, the Life Rooms as well. There's the royal visits to those establishments as well. And you've been very much at the forefront of those things. Can I ask you, in terms of your journey on this, is mental health something you've always been aware of? Was it something that you thought could be a new frontier and something that Mersey Care could really take a lead on?
It's a very interesting question. I other people have asked me that, and when I was probably less prepared for the question, you know, I did go away then and think about it. But I come from 4 generations of mental health professionals. I'm not a mental health professional myself. I'm not clinically qualified, actually. But my grandfather, and as far as I can go back, his father worked in what would have then been the old asylums, but they were involved in mental health nursing. My own father was a mental health nurse for almost 30 years, and I have a brother and a cousin in mental health nursing. So I've been sort of surrounded by it all my life, in effect, but never, in a sense, truly thought about it. I've worked in the NHS for knocking on 30-odd years now, and for the first 23 of those, really never bothered much with mental health services, did all sorts of other things. And then when the opportunity to apply for the Chief Executive's role for Mersey Care came up, as one does a bit of research on these things, I got totally intrigued by what for me felt like, a tremendous opportunity to come to a good organisation and all of those sorts of things. But I suppose to your point, I felt like there was something hugely untapped in the opportunity, I think, to radically upgrade our thinking about mental illness, to make sure that we talk about the flip side of that coin, which is mental well-being. And also, somewhere inside me, it felt that this whole thing around mental health stigma didn't quite fit with the NHS that I worked in and wanted to believe in, and still believe very strongly in, as a sort of social movement around equality for people. And, we still struggle with inequalities right across the NHS, of course. But you see that equality particularly writ large for people with mental illness or learning disability and so on. So that felt like a very strong attractant to me. And I suppose if you look at certainly what we've done with the sort of services that we have in Mersey Care, I feel very proud actually that, I'm not going to say I've done it, I'm very proud that the people who work in the organisation organised around that notion of, I suppose, a little bit of righteous indignation that it wasn't right, really wasn't right. There's a lot that we need to do still as an organisation. There's a lot the system, our health service needs to get to. But when I look back just over the 7 years I've been in it, you and me wouldn't have been having this conversation. You wouldn't have been introducing a radio programme, with a regular mental health spot and so on. So just this conversation alone is testimony to how it's moved on. I think you're right, however, to point out that our region, the city of Liverpool itself, has some real issues with the mental health and mental well-being of the population, but is also a place that rises to meet those issues. So it's probably a great combination of having found a lot of instinctive interest in what goes on in mental health, some huge big challenges which, sometimes in your career you find you want to rise to a challenge. Mental health has sort of been that for me. But coming to an organisation and a place where people have got the will and the energy to get underneath this is 99.9% of what has been achieved. I think I've just been in the right place at the right time, frankly.
In terms of making a change in an organisation the size of the NHS, some people would imagine, the huge tanker that's moving, and if you want to suddenly go, you know what? I see the world in a slightly different way, and I think we can change the direction of where this tanker is going. There'd be plenty of people on the tanker who go, you know what, Joe, this is the way the tanker goes. This is the way the tanker's always gone. And to be honest, if we just carry on, that'll be fine. No one's really mentioned it before, this idea of changing anything. And you wanting to change something is going to inconvenience a load of people because we have to change mindsets, we have to change attitudes. Was it like that, or did you suddenly have, as I found with many people, light bulb moments? People go, all right, you want to do something a bit different. I understand that because it's evidence-based, stats-based, it's got the data that backs it up, and also really great lived experience evidence, which anyone who hears, sees, reads, understands, completely gets on board with.
Yeah. The answer is it's a combination of all of those things. I think if you set yourself out as a potential outlier in a great big monolith like the NHS, there's a fair chance that, a bit like that game Whack-A-Mole, somebody comes along and just bangs you back into place, type of thing. But in fairness, actually the NHS isn't really like that. It's a national health system, of course, but healthcare delivery organisations like Mersey Care are statutory trusts. They're governed by boards, and the idea, in a sense, is to create a sort of enterprise attitude where people will change things, where people will, as you exactly said, start to say, well, we've noticed that we're not performing as well on some of these areas as others. What are we going to do about it? We should have the freedom to innovate and operate within reason. Of course, we can't do outrageous things, But once you, I think, establish your reputation for being, I would say it's important to be seen as a safe pair of hands. So somebody who will, along with the board and the organisation, make really good decisions on behalf of the people you serve. Then I think you can start to stretch the piece of elastic a little bit and see how far you go before it sort of twangs back and hits you awkwardly on, the hand type of thing.
Has it twanged yet?
Not so far, but I wait the moment. But I think too, you mentioned mindset, and I think if you're going to do some of this type of work, then I think you need to have a can-do mindset. You need to have. I'm a natural optimist, so I'd rather work out why we try and do something rather than deal with 101 reasons why you can't do it.
Oh, absolutely. When we started doing the programme, when I did my journalism training, I was always told asking the question, how do you feel, was a lazy question. So don't ask anyone, never ask anyone, how do you feel? And also there's this other thing of there's no new ideas in radio. Everything's always been done in radio. So we were up against this thing on the programme, which was asking the one question you weren't supposed to ask, but also trying to come up with a new idea, being told that there's no such thing. As a new idea anymore. Yeah. But then also having the sort of optimism that if we did start asking that question, that people would respond.
Yeah, and there's a sort of question that goes alongside it, I think, Mick, which is, well, so what harm is it going to do? If it doesn't work out, then go and do something different, And often certainly with many of the things we've done, we've been very, very careful about, I think, not putting too much risk into it, or if you think about the life rooms as an example, which was, a really big change for us. We've monitored very carefully, to make sure that with every step, we're absolutely certain that we're ready to take the next step in that respect. But I do think one of the things that we've been particularly successful in doing is we introduced this idea of having big, hairy, audacious goals. We call them BHAGs. Now, we didn't invent that. That was. I was
going to write that one down.
That was invented actually by a guy in the States who is pretty famous. But the big, hairy, audacious goal is that moment, probably like your producers thought, Mike, when you said, well, actually, I'm going to introduce this, once a week. We're going to talk about mental health and we're going to talk about feelings. Where you think, I'm going to have to, that's quite a big idea, and it can be so big that it makes people think a little bit, It's hairy because you really need everybody on board to start to do it. It's audacious because actually when people say to you, well, how exactly are you going to achieve this? You go, I don't really know, but we're going to try and do something here. Life Rooms was a bit like that for us, but certainly the Zero Suicide Alliance, when we said, well, actually, we're going to introduce a policy that says that nobody in our care will die by suicide. We had a very long conversation about the improbability of being able to deliver that, is one thing. Secondly, well, is it a target? So if we don't get to zero, are you going to beat us up? We had all of those discussions, which is what makes it a big, hairy, audacious goal. But rather curiously, at the back end of it, when you start to think about using approaches like that with, we've got now just under 10,000 staff in the organisation. But what it does is almost permit those 10,000 people to have a conversation about something that's pretty radical. Suppose if 9,999 of them said to me, do you know what, this time that's a step too far, then I've got to listen. But what's been really interesting for us, as we've talked about zero suicide, we've talked about zero restrictive practices in mental health. So, let's not hold people down if it's possible to avoid it. Let's not over-medicate people, those types of things. We've talked in our physical healthcare services about zero pressure ulcers, something that just shouldn't happen. And rather than seeing a big backlash to that, actually staff saw it as an invitation to become innovative. Because actually, in our wonderful NHS, we're so busy every day, and we've never been busier than we've been in the past couple of months. And it's very easy to sort of get the hamster on the treadmill moment. And you're so busy getting through the day that you stop evaluating, you stop thinking about what could we do different, what could we do next. And you can't have hundreds of big, hairy, audacious goals. Otherwise, your head pops at some stage. But we've got 4 or 5 of them, and that, I think, permits staff to begin to think differently. So, around zero suicide, we really, what grew out of that was the notion that an awful lot of people, and when we've looked at the figure, it's over 80%. 80% of people think suicide's inevitable. And that made us ask a really simple question. If you think suicide's inevitable, you probably don't think you can prevent it. Yet, for 25 years, the Department of Health, Public Health England, local councils have written suicide prevention plans. And those haven't always been as successful as they could have been. And I suppose it got us to that point in time of thinking, actually, we've got to tackle the culture of belief around this before we're actually going to get suicide prevention to a place where I think we could see a dramatic impact on the number of people taking their own lives. And I know you've talked before with colleagues around the Zero Suicide Alliance training. And, the before and after question, beforehand, 80-odd% of people think suicide's inevitable. After a 20-minute input, that drops to 10%. That's a pretty radical change for a 20-minute investment in time.
Absolutely.
But what it means is we've now got, a lot more people willing to engage in the next step question, which is, well, really, if it's preventable, then what can we do? So that's a bit of a story of how these BHAGs go from being a sort of, the big, hairy, audacious thing into something that becomes about practical delivery over a period of time.
Absolutely. But then I guess that's the other thing of, everybody in their life can have a BHAG. It can be about yourself, it can be about an ambition, it can be a dream, a hope, an aspiration as well, and achieving, don't have too many on the go at any one time, but absolutely, we can all achieve a BHAG. I'm taking that away from the conversation today. In terms of the Zero Suicide Alliance, how does this stack up? Some people will know and will have heard of this at a national level. They may have seen things on their national news about Zero Suicide Alliance. Tell us about the influence, Merseyside's influence, if you like, of the Zero Suicide Alliance.
Yeah, so the Alliance itself is a sort of, it's based on the concept of a social movement. So anybody can be a member of the Alliance. There's no fee to join the Alliance. There are no hurdles to people doing more with the Alliance. We were lucky, however, that the work in establishing the Alliance, and actually that thing about, to go back to the notion of the big, hairy, audacious goal, I think it said, we're an alliance that is going to reduce suicide by 10% in the next 5 years using continuous improvement methodology or something like that. You've already gone asleep, you say. So it's not exactly engaging. When you say to somebody, zero suicide, intellectually they think, well, actually, that's not a proposition I've heard before, and that opens up the conversation. Now, we were very able to do that because of the sort of coalition of people we have in the Alliance, both, brilliant clinical people, great leaders, and of course lots of people with lived experience, who bring home their stories with very great impact. But we were, because of that combination and the use of the sort of a provocative term like zero suicide. I think cross-party politics really got a hold of it in Parliament. And one of the things that we were very fortunate to get was funding, at the time signed off by Jeremy Hunt, for a couple of years, so £2 million for 2 years. We're just through the first year of that now. And that's allowed us to put together a sort of platform of things we want to do. First is to make sure we get 1 million people trained. So in terms of what are we doing locally, so we've worked with Steve Rotherham and colleagues to work with businesses all across Merseyside to say, well, actually, you've got hundreds of thousands of employees between you. You've got a duty to those people. You will know the statistics like I do, 1 in 4 people at any one point in time with a mental health issue. 3/4 of the number of people who die by suicide are men, the other quarter women, and so on. So we've worked with employers right across Merseyside to begin to say, so what would an employer do to create a sort of really positive workplace that is centred around mental well-being in the first instance? And then secondly, what would you do to sort of upskill your staff to deal with somebody with a mental illness? So slightly different to the well-being piece. And then lastly, we've said, what is it that you would do if a member of your staff started to express suicidal thoughts? So those three layers, we've used the Alliance really as a platform. We've used the training as a sort of really simple, cost-effective way, and it's cost-effective because it's for nothing, So that's great. And what we've got now is about 20 businesses across Merseyside. Some of them pretty big employers actually, who have now begun to say 3 really interesting questions. How do we go about doing that? Now, the answers may be different if you, run a business that is mainly serviced by, men under the age of 40, which is a very different thing from, let's say, a business where you got a lot of women working in it, or you've got businesses where people all work within 200 square feet of each other versus, dispersed workforces and so on. So we've been working very hard to begin to generate a set of locally relevant sort of toolkits, really, for those businesses to work with. The logic being that, well-rehearsed figures again, one life lost is one too many, of course, in my view. But around 200 to 300 people affected by any single death by suicide. So you begin to see how both there is a human component to this. The tragedy of loss is just indescribable. But equally, if we're going to, across the city region, make Merseyside a place to come and feel healthy and bring your children up and inwardly invest and do all of those things, then I think it's really important that we produce the healthiest workforce possible, and that's a part of being a healthy workforce.
Are you seeing, obviously, when you make a connection with someone like a Metro Mayor and you talk to institutions and businesses, then that's one way of getting the message through. Are you seeing the other side of thing, which is almost like a grassroots movement, so people saying, hey, this is a great workplace, and you tell us all about hard hats and high-vis jackets and steel-toe cap boots. What about this other stuff? Can we get on board with this? Can we get the training that comes from the Zero Suicide Alliance? Are you seeing that almost people are demanding that of their workplaces?
There's 2 ways. We can push some of it, which we do, but there's no question we're seeing probably on balance more of a pull than a push. I think that's because we've now started, I think, to see a sort of an awakening of awareness, just about everywhere actually about mental health and well-being, particularly around the zero suicide piece. What I've observed now over the past 4 or 5 years or so is, suicides themselves are actually rare events. But people who have been affected by suicide are not rare. So it doesn't take long, Mick, when we sit down to, for example, work with a company, for somebody to come along and say, do you know when I was 15, ... And this could be a 60-year-old man, So what we're starting, I think, now to uncover is both the pull for this, because people want to feel that sense of knowing what to do next. But actually what we're seeing are loads and loads and loads of people who, through their lifetime, have experienced some form of grief, some sort of impact of death by suicide, and effectively they carry that with them. And this is a tremendous opportunity to both talk about it, to maybe start their own process of recovery in that sense, but also really brilliantly and importantly, people are saying to us, well, so on our experience, can we help? And that's the notion of the social movement. That's music to our ears in that sense.
Joe Rafferty is with us on Mental Health Monday. Zero Suicide Alliance, type that into any search engine and you'll get all the information. You can also take that 20-minute training as well, which is right there, front and centre on the website. We've had the team on talking about life rooms and the expansion of life rooms, Walton Library, most recently Hugh Baird College. And I sometimes hear conversations, this idea that there's a drop and there's a point where, if there is a conversation to be had about mental health, there's a place that you can go and it's It's the idea behind the life rooms. And you can listen to previous editions of the show, by the way, if you want to catch up on the life rooms and the life room stories. Sometimes I hear people talking about the future of the high streets. What are we going to do with all these shops? When these shops close down, what is our high street going to look like? And I often think at the back of my mind, the life rooms model could actually be very much part of the future of the UK high street, where that will be there in the same way there'll be, something that sells sports gear, a coffee shop, a pub, a restaurant, and a life rooms. Is that something which fits in with a BHAG
it totally
around
fits,
life rooms?
It totally fits in, and it's a conversation we've been having for a while, actually. So in the early days of the life rooms, we've sort of gone with the energy, in a sense, wherever we can sort of get a foothold. So Walton Library is the first, Southport is the second, Hugh Bird's the third. We've now diversified into the centre of Liverpool in one of the theatres. And also in the south of the city at the Garston Walk-in Centre, and that in a part, those the first three feel a little bit different from the second set, and in the second set, I think you can get to see diversification starting to take place. So the idea that we would operate out of a theatre where other business just goes on a by the by. Feels to us like the sort of model that we may want to do more of as we go. So I think it's a great question. If you reimagine the high street, what would that look like? But a place where we would have a completely normal perspective on talking about how we feel. That's really different from talking about mental illness. The two things are they overlap a bit, but they're not necessarily the same thing. And I think for me, the one thing every time I see our life rooms in operation that makes me sort of quietly swell with pride is I can't tell in those life rooms who is, a formal patient of Mersey Care, who is somebody who's approached the life rooms for the first time because they've sort of heard about them and they've got a question in their head about how they're feeling and how they're processing those thoughts. And indeed, when I see a bunch of kids from the local school sat doing their homework on the computers, for me, we have taken a massive step towards destigmatising this whole business,
Joe, we're fast running out of time. There's a million and one more questions to ask you. I'll ask you this one, because whenever I'm outside of the Merseyside area and people go, oh, what's the thing about, and they'll ask about, it might be life rooms, it might be James's place, it might be Zero Suicide Alliance, it might be about Hub of Hope, it may be a million and one different things. They kind of go, they always ask me, what response and what reaction are you seeing? And I don't have data sets for hospital admissions and I don't have data sets for GP appointments. But I can talk about the anecdotal evidence, the things that we hear, the events that come up, the different inspiration and aspirations that people show as well. I guess in your job, you're closer to that data set. You're closer to that. Can you give us an insight into the sort of, when people talk about Zero Suicide Alliance, when they talk about life rooms, when they talk about making connections with, mental health aware organisations, what value is that bringing? What are we seeing?
Yeah, it's a great question. So. In terms of the Zero Suicide Alliance and our own ambition in Mersey Care, in the last 3 years we have seen a 30% reduction in deaths of patients in the care of Mersey Care. So that's on average 10% a year. If I compare that to the sort of national ambition, which is to reduce deaths by suicide of people in care by 10% over the next 4 years, you can see that actually this conversation is having the net effect of it is to increase the rate at which we're doing effective prevention. We've got a long way to go, but I give you that figure to show that deaths by suicide in our organisation, patients in our organisation, are dropping faster than the rate, generally speaking. So that's, I think, the sort of thing you're talking about. We know for people in contact with our life rooms, we have done some studies where we've, as best we can, looked at people who come to the life rooms versus people who come to Mersey Care's more traditional services. We see the satisfaction with people who come to the life rooms is miles higher, actually. miles higher. So if you take, just the fact that people, if you take that as a sort of likelihood to engage sort of indicator, much more likely to engage with the life rooms. If you look at less dependency on traditional mood-altering medications and so on, we're seeing benefits in the life room. And overall, and this is important in the big equation, overall it's cheaper to run the life rooms than it is to run a traditional mental health model. So, there's a couple of examples where if you say to me, is there a bankable benefit, both in terms of clinical outcome experience for patients and for the overall public purse, that's a couple of examples. Other things then, I was interested, you said Liverpool gets sound checked on some great approaches. You mentioned James's Place, which is just, a star attraction really in that sense. But one of the things I think that we've been doing really well is working together. So rather than pulling apart, and sometimes it can feel terribly fragmented. And that's one of the huge benefits of the life rooms, is it's become a sort of connector for lots of voluntary sector organisations across the city and across Sefton to truly work into and through. And particularly as money's got really tight, we've sort of been able to say, well, we've space here, you can run your service out of here or whatever. So that feels like we're getting a lot more cohesive around this. And if I give you one more indicator then that I think is really important, and because we've created that community fabric, I think we are able to think about who, as patients, are better in a hospital bed, in a mental health bed, because we can feel really confident that some people can be managed better in the community because there is this spread, this great blanket of organisations and opportunity. So therefore, I think we're now starting to get better at getting the right people into mental health beds who need to be there. And sort of the thing that I would point to, the success factor on that is, that many mental health patients are often placed hundreds of miles away from where they live. Well, Mersey Care hasn't put a patient outside of Mersey Care in over 2.5 years, which is a huge achievement when you think about it. So there are some real tangible indicators of doing all of this stuff, converting into those sorts of real benefits, because, as you say, it's interesting to do it, but you're right, it has to make a difference.
Joe Rafferty, CBE, Chief Executive of the Mersey Care NHS Trust. Absolute pleasure to get you on the programme. Thank you for your time.
Mick, it's been a pleasure. Thank you.
Mental Health Monday
On Radio City Talk.
with Mick Coyle.
Tackling the stigma.
Radio City Talk.